So I'm going to show you a picture that I call sort of the crystal ball. And somebody once told me, be careful. People who look into crystal balls often eat glass. So I'll take that as a warning. But here's 4 generations going across the top. Now there's actually 5 building blocks that I like to identify. And again, know these charts. There's going to be a lot of questions on these charts. The 5 building blocks, and you can pick out your own if you want to add one. Personal care accounts, that would be all the FSAs, HRAs, and HSAs. FSA, all those. Personal care accounts, wellness prevention. Again, sometimes that's called health management, so you'll see that term as well. Health management, not just wellness prevention. Disease management, again, what's it called in some cases? Condition management. Information decision support is also called health literacy. Know that. You're going to need to know that. And then incentives and rewards. Those are the building blocks. Those are the generations. And we're going to take a break right now, but I'm going to leave you. And we'll come back and we'll talk about this. You put all that together and you can actually see a high-level overview of where we are, where we've been, and more importantly, where we're going. So if you have a strategy, you can actually build some of these ideas in as to where the market's going. But we've already talked about it going across the top, the 4 generations. Real important for you to know. We're going to have a lot of questions on the exam about generation, what they mean. The building blocks here. And then as you can see, we've already been down a little bit each of these. But for example, the first generation, initial account only. This is the only ones that typically, for the young and healthy and wealthy, criticized. Preventive care services, 100% preventive care services were under these with the high deductible. So it didn't leave people without being able to get some care. There was much more preventive care in these than in traditional PPOs. And rewards and incentives were sort of outside the plan in many cases. Cash, trinkets, movie theater tickets, American Express gift cards, those sorts of things. This is where we are for the most part today. I think about halfway through here because we've gotten a lot more creative in the last year about what rewards and incentives are. But again, it's not just an initial account, it's activity and compliance. And let me emphasize that as these generations develop, they don't totally replace the prior generations. They build on them. So you'll see products and services that are some of every generation in a given plan. You can't be an employer and say, oh, this is great and wonderful. Ron put together this whole concept, makes some sense, I can see it visually. I want a 4th generation plan. The providers aren't there. The vendors aren't there. You can't do that. A vendor, a solution provider, can't say, well, I'm going to develop 4th generation products. But when they go to sell them, they find out that the benefit manager is thinking about all the 2nd generation issues. And there's an old saying, all learning occurs in the mind of the listener. All learning occurs in the mind of the listener. Translated another way, if you're speaking 4th generation language about the great and wonderful benefits, but their mindset is 2nd generation, you're not connecting. They won't understand. So if you've got a 4th generation product, and I get a lot of entrepreneurs and people with great ideas developing products, I said, okay, that's great, but you're a 4th generation company. You better explain it in terms of a 2nd generation mindset. How's it going to fit into there? Because most of the people, quite honestly, and I don't know about each of you individually what your real goal was in coming to this session, but I know historically, as people say, I've done some things, I want to know what's next. What's next? What do I do next? Don't tell me about the past, and don't give me surveys about this or that. I want to give me some ideas of what I can do next. And I hope that's what you get out of this session more than anything else, is there are ideas, whether it fits into your organization or your organization, there are a lot of things you can do. 3rd generation, again, I think we're seeing more and more of that 3rd generation that involves how does your health care affect your employment, and how does your employer affect your health care in the environment that you're in. And I'm going to show you a couple of slides that I think are really important to look at that involve, most employers don't understand mental health stuff. They don't understand bipolar and schizophrenia. What most employers do understand is stress and depression. I'm going to show you the impact of stress and depression across your health care. And if you're not doing that, trust me, if you don't have a stress management program in your organization, your employees do. Because they deal with stress somehow or other. Comfort foods, smoking, alcohol, drugs, they will deal with their stress one way or the other. So you need to have, among all the other things, a good stress management program. 4th generation, we're going to talk very personalized devices. I like some of the things down here. Arrive in time information services so that the doctor and the patient actually are getting the same information, that alignment chart I showed you earlier, so that the patient and the provider have similar information. Patient's never going to be an MD, but they ought to get more information about making choices, like I mentioned with my sister's cancer. It's what I call information therapy. I would love to get to the position where healthcare consumerism, the doctor gives a prescription for whatever medication or treatment plan that patient's going to have, and he then also gives a prescription for the information that ought to be reviewed consistent with that treatment plan. So the patient can go home, and maybe online, where the doctor knows that this is the way he's practicing medicine, and said, listen, we're taking some tests. We don't have final results yet. This is the direction we're looking at. There are 10 chapters. Go read the first 2 chapters. Don't go beyond that. You know that they will. But read the first 2 chapters, and you'll understand where we are and what the possibilities are. And when you come back, we can have a more intelligent discussion about what's going on. Because when somebody's diagnosed with cancer, how much do you think they hear after that? Not a whole heck of a lot. So they need some time to go and do some research. We don't want them to just go Googling and get all sorts of stuff in. But if you have them directed with what I call information therapy, you can get some consistency there.